come up with measures or emergency response teams in the fight against COVID-19. Now, the Ministry of Health has invited several stakeholders, agencies, partners who can support or closely coordinate this fight against the COVID-19 with them. It is not working with any parallel arrangements like the way Dr. Kizza Besigye is coming out to say that his government, I don't know whether we have two heads of state. Of course, it is an illegality for him to come out and claim that his government has set up emergency teams to transport expectant mothers, sick children, elderly people, and people with disabilities, together with those with COVID-19 symptoms to health centers. Now, the Ministry of Health has noted that they have been getting patients and simply dumping them. And this is outside the arrangement that the Ministry of Health has, that if somebody has gotten into an accident, then there is where the ambulances from Ministry of Health direct that patient. If there is somebody who is supposed to undergo like an expectant mother, they know where to take that person. If there are cases of TB, cancer, and so on, they know where to rush those victims. Now, what has been happening, they are claiming that the retired Colonel Dr. Kizza Besigye with his team are just picking onto patients and just dumping them anyhow, and something that they strongly object to. We as the police, we come out to condemn this. It is an illegality, first of all. We don't have any parallel government. And also, we want to urge the retired Colonel Dr. Kizza Besigye to stop using the fight against the coronavirus as a tool for to politicize things, you know, and trying to gain political points out of the pandemic. This is simply a time where we as a country are supposed to jointly come out, coordinate efforts to fight this virus. So the Ministry of Health has invited anyone, including him, if he has an arrangement, let they work jointly together in promoting unity in the face of this crisis as the way to go, other than sowing acts of divisionism. So the Ministry of Health ambulances have stickers, and those stickers, we are encouraging the public. If you see stickers, a Ministry of Health vehicle coming to respond to maybe a suspected somebody showing signs of COVID-19, the Ministry of Health vehicle have stickers, and they know where we are taking these people for quarantine and also for medical attention. So our officers in traffic have been alerted. So if there are people who are using their ambulances in a manner that is contrary to the guidelines by the Ministry of Health, definitely we shall come out to take action on those ones. Nga ono abadde avuddeyo n'akabondo ng'alaga nti ye nga retired Colonel Dr. Kizza Besigye wamu ne gavumenti ye babadde balina enteekateeka ey'okudduukirira abo abakyala abazito, abaana abalwadde, abalina obulemu, n'abo abateebereza okubeera ne ssenyiga ono lubyamiro ono omukambwe oba ssenyiga ow'amaanyi. Naye ng'aba minisitule y'ebyobulamu enenkola eyawukana n'eyaabwe tebakkiriziganya nayo, kubanga be bakulembeddemu okulaba nti bateeka amaanyi mu kulaba nti balwana okulemesa ekirwadde kino ekya coronavirus okusaasaana mu ggwanga. Era balina ebitongole bingi ebyobwannannyini n'ebya gavumenti bye basikiriza okujja okukolagana nabo So buli yenna akola wabweru w'enkola ya ministry ya health oba ministry y'ebyobulamu tagenda kukkirizibwa kujja na nkola yiye nga ye, kubanga eba ekontana n'enteekateeka eziriwo eziri mu butongole. Kati ng'ekyokulabirako bano babadde bagenda ne baddira abalwadde ne babajja gye babajje ne bagenda ne babasuula mu malwaliro, nga abamu ku bo kakati nga abantu abafunye obubenje oba accident bwe zityo baba balina kutwalibwa casualty unit. Kale ate bw'ogenda n'omusuula wali e Kawempe, then obudde obw'okumuggyaawo okumuleeta awo, mulimu abalwadde ba TB, mulimu abalwadde ba kansa, mulimu abagenda okuzaala, mulimu mu kiseera kino abateebereza okuba nti balina omusujja guno ogwa coronavirus. So togenda kumala gamukwata kumutwala kumuteeka wano. So aba Ministry of Health balina emmotoka zaabwe za Ministry of Health, kuliko sitiika, era twagala abakulembeze batunuulire emmotoka ng'eriko sitiika yeba ejja n'eyamba mu kukwata abantu abalwadde n'okulaba nti ebatwala awantu awatuufu mu kifo ky'okukozesa ebyobufuzi mu ngeri esobola te okukosa oyo omulwadde yandibadde ataasibwa. And we as the law enforcement agencies under the Joint Security Task Force, we also continue to play a very critical role in enforcing the directives of His Excellency the President and the Ministry of Health guidelines to ensure society continues to function in a civil manner. Now, during the course of last week, we intensified our operations to counter levels of non-compliance towards the partial lockdown. We've opened investigations on people who were found violating the ban on public gatherings, social distancing, and proper hygiene. And we have sanctioned these ones at different levels. As we talk now, there are people who are going to court. I think as of today, people like Pastor Iga and the others. We also have continued to issue warnings and cautioning those ones who are trying to play ignorance to the law. And then there are those cases that we are deferring, awaiting the full resumption of court business, and then we shall reactivate them for purposes of having these people charged. So this is a sign that we as the joint security agencies are not tolerating any acts of non-compliance during this period. We've managed to effectively police the city center and most of the municipals and towns. Now, our commanders have noticed that there are still pockets of defiance, especially by border riders who continue in the suburbs and also in the rural places. They continue to stealthily go out ferrying passengers on borders, and it is very risky. Because now if the border rider is the one who is sick and he continues, then you can see how he goes on intentionally spreading or infecting others with the virus. So this threat of the pandemic is still on, and we would like to remind all Ugandans that the way we respond to the directives and guidelines issued is very key in determining the extent and pace of the spread of the coronavirus. If we tend to be lax and think that it is only those people who are quarantined, then that is something that is very false, which we should really fight. So let's continue maintaining social distance and adopting changes in our behavior as we get to move forward. Our officers have been guided that where there is flexibility, they should use their discretion appropriately. For instance, there are There are those who have these. There are people who have private vehicles, 14-seater vans, okay? And if at all he's moving with a family, he may not necessarily restrict himself to 3 people, because you can have one person sitting per what? Per seat. So an officer, out of his discretion, will judge and say there is no close contact during this period. And these people can use the what? Instances where you are trying to save someone, and then we see you driving your taxi, you are rushing somebody to hospital. Definitely, that one is what? Is understandable. The Ministry of Transport said if there is a taxi which is transporting food, now why should you really what? Why should you stop it? It is carrying an essential item during this period. So there is that discretion which has to be used in a very what? A very appropriate manner. You get the point.